ਤੁਸੀਂ ਆਪਣੀ ਪੋਜੀਸ਼ਨ ਲਓ, ਤੁਸੀਂ ਇੱਥੋਂ ਕਰਨਾ ਜੀ ਤੇ ਬੈਠ ਜਾਓਗੇ।
नहीं मैं बैठ जाऊँगा सर।
बैठ जाओ, इन्होंने इतने स्पेस दे दो। लैपटॉप इधर कर लो, मैंने लैपटॉप इधर कर दो।
Welcome to the tour of newly created Patriotic COVID Ward.
आपने पीछे लगा सकते हो आप वहाँ पे,
इतने ला सकते
हाँ उसके बैक साइड से खड़ सकते हो आप।
स्क्रीन में लग जाना है ना,
तो स्क्रीन पे कोई नहीं देखता, स्क्रीन पे साइड पे देखते हैं वैसे।
इतने देखना।
हाँ जो अगले नहीं वो इधर देखना, जो पिछले उन्होंने वो देखना। स्टैंड है तो स्टैंड लगा लो, फिक्स हो जाएगा।
फिक्स लगा लो। हाँ जी ये अगली जैसे इनॉग्रेशन होनी है, सबसे पहले टीवी दिखाना।
Welcome to the tour of newly created Patriotic COVID Ward, as next COVID wave is expected to affect children. This ward has been established with kind and generous contribution by Police Public Foundation at an estimated cost of rupees 60 to 70 lakhs within a short time. This ward of 50 beds will handle level 2 category of patients with infections. Strategically located, this ward is equipped with state-of-art equipment, that is cardiac monitors, cardiac defibrillators, oxygen concentrators, syringe pumps, and new ECG machines. Second wave of COVID has been a disastrous shock and taken life of too many people because of oxygen. Taking the oxygen mission forward, members of CII and Ludhiana industry came forward and contributed approximately rupees 1.25 crores for setting up oxygen plants at CMC and Krishna Charitable Hospital. An MOU has been signed wherein these hospitals will provide subsidized treatment to poor patients. These plants will be set up in 6 and 8 weeks and will cater the oxygen needs of hospitals around the year.
रिकॉर्डिंग आती है मैं ठीक है कल का सुनो जब शुरू होनी है एक तो पर्दा बोलूँ तो पर्दा बोलूँगा तो वीडियो चलेगी हफ्ता की वीडियो चलेगी चलो एक बंदे बोलने लग गए तो कैमरा इधर घुमा देंगे ठीक है रिकॉर्डिंग बिल्कुल नहीं करना उनका चाहे बंद चेक कर उनका बंद कर रिकॉर्डिंग में
पवन लुधियाना ऑडियो वीडियो आ रही है तो क्लियर है। पवन लुधियाना ऑडियो वीडियो क्लियर है जी मेरी? ओके जी। CMC लुधियाना ऑडियो वीडियो आ रही है। CMC लुधियाना ਤੁਸੀਂ ਵੀਡੀਓ ਸਰ ਤੁਹਾਡੇ CMC ਕੋਲ ਸੇਮ ਨੇਮ ਤੋਂ ਦੋ ਬੰਦੇ ਹੋਰ ਜੁੜੇ ਹੋਏ ਆ ਜੀ।
ਹਾਂਜੀ ਹਾਂਜੀ
ਤੇ ਉਹ ਤੁਹਾਡੇ ਰੂਮ ਤੇ ਤਾਂ ਇੱਕੋ ਆਈ ਨਹੀਂ।
ਨਹੀਂ ਉਹਨਾਂ ਦੀ ਆਡੀਓ ਬੰਦ ਹੈ ਜੀ।
ਅੱਛਾ
ਉਹ ਅਲੱਗ ਰੂਮ ਹੈ ਜ਼ਰੂਰ ਹੈ।
ਇੱਕੋ ਸਰ ਫੇਰ ਵੀ ਆਂਦੀ ਹੈ ਇਹ ਭਾਈ ਸੇਮ ਰੂਮ 'ਚ ਰਹਿਣ। ਹਾਲੇ ਵੀ ਦੇਖੋ ਮੈਂ ਗੱਲ ਕਰ ਰਿਹਾ ਹਾਂ ਮੈਂ ਕਲਾਸ ਸੁਣ ਰਹੀ ਹੈ।
अच्छा वैसे एक रूम है नहीं मैं वो उसको बंद करवा
देख लो कितना चेक करा लो दो है कितना तीन है ਤੁਹਾਡੇ ਲੌਗਇਨ ਨਾ ਤੇ ਚੈੱਕ ਕਰਾ ਲਓ ਸਿੰਗਲ ਕਲੈਰਿਟੀ रहेगी। हाँ जी
सर हम इको बंद हो गई।
हाँ जी इको बंद हो गई।
ठीक है ओके ओके
बंदा फोकस करना हाँ इतने आऊगा ठीक है। बाकी मूवेबल सी दिखा राशन दिखाना बस जिते मतलब एक वर्दी वाले तो लैके जो नीली पट्टी वाला नहीं इधर मूँह रख बैठा टाई वाले के नाल जो सिर हिला रहा इन्हें कल तुहानू नंबर दिता सी सामने बैठा हो।
हाँ जी CMC लुधियाना एक बार फेस तो कराया जी टेस्टिंग अपने वालों
जो हथ उत्ते जो जोड़ रहा इतने तक ही दिखाऊंगा बस ठीक है।
हेलो गुड आफ्टरनून CMC लुधियाना।
हम ठीक है
यहाँ से क्या सर?
यस सर क्लियर
And video is also there, sir?
यस सर
Thank you sir, thank you.
पिछली पग पुग ना कट्टे थे
थैंक यू सर।
या क्लोज करना क्लोज से कर दो।
CMC लुधियाना, क्या आप बता सकते हैं जो बाकी दो CMC है वहाँ पे कौन बैठा है, या फिर आप डिस्प्ले में चेंज कर दीजिए जो डेजिग्नेशन है उनकी। CMC लुधियाना।
हेलो
हाँ जी सर, जो CMC लुधियाना के नाम तो दो और CMC ज्वाइन है ना, या तो उन्होंने डेजिग्नेशन लॉग इन कर दो या उन्होंने वीडियो ऑन करा दो, या उन्होंने
ठीक है ठीक है।
सामने से मैनेजमेंट की प्रॉब्लम हो रही है।
Good afternoon, Varinder, Rakesh, Dr. Bhatti. Good afternoon, Ji. Great work by all of you.
Can we start here?
Good afternoon, sir.
Good afternoon, Ji.
Team Ludhiana, please begin.
Good evening. I am Neeraj Speaker, Senior Vice President, PPF. Cordially welcomes Honorable Chief Minister of Punjab for attending today's function. I am also grateful to acknowledge the presence of Chief Secretary Madam Vinny Mahajan Ji, DGP Sir Vikram Gupta Ji, and all other distinguished senior members of the administration. CM Sir, before proceeding further, I would like to give a little background regarding the setting up of PPF board in a record time of 3 weeks. Sir, जो आज की सिचुएशन है एक जंग के समान है, वॉर टाइप सिचुएशन है जिन्हें विच अपन अपना दुश्मन भी दिखता नहीं है जो कि कोविड-19 है। इस समय ਦੇ ਵਿੱਚ जो डॉक्टर साहबान, नर्सिंग, पुलिस पर्सनल, पैरामेडिक्स, डिस्ट्रिक्ट एडमिनिस्ट्रेशन ने जो साथ दिता है, सहयोग दिता है, वो काबिल तारीफ है। ਉਹਦੇ ਲਈ मैं सिर झुकाता हूँ। सर, एक PPF का 50 ਬੈੱਡ ਦਾ ਵਾਰਡ ਜਿਹੜਾ ਬਣਾਇਆ ਗਿਆ ਹੈ ਇਹਦੇ ਵਿੱਚ 20% ਬੈੱਡਸ PPF बिलो पावर्टी लाइन लोगों लिए रखे गए हैं ਜਿਹੜੇ कि मुफ्त होंगे, सिर्फ कंज्यूमेबल का चार्ज किया जाएगा, बाकी के बेड के उत्ते भी डिस्काउंट सर दिया जाएगा। सर आई वुड ऑल्सो लाइक टू थैंक few people from administration जिन्होंने बहुत सहयोग दिता ताकि असी रिकॉर्ड टाइम से पूर्ण कर पाए। सर ADGP ढोके सर जोड़े चेयरमैन ने संस्था के, DC सर, कमिश्नर पुलिस सर राकेश अग्रवाल जी, अश्विनी कपूर जी फॉर देयर सपोर्ट एंड सर कुछ मैंबर्स ने बहुत साथ दिता साडा, SC रलन जी जोड़े कि पास्ट प्रेजिडेंट हैं FIO के, सबीरा बैकर जी, राहुल जी ते कोहल साहब, मृदुला जैन। सर ये जोड़ा वार्ड है बिल्कुल तैयार हो चुका है सर एंड ये अंदर जी कॉन्ट्रीब्यूशन की है इंडस्ट्री के लोगों ने की है सर, बस मैं उन्हों का बहुत थैंकफुल हाँ सर फॉर द जनरस कॉन्ट्रीब्यूशन टुवर्ड द वार्ड। सर नाउ आई रिक्वेस्ट CP सर राकेश अग्रवाल जी फॉर्मली वेलकम ऑल। थैंक यू
सर। मैं आज के इस प्रोग्राम में मानयोग मुख्यमंत्री पंजाब कैप्टन अमरिंदर सिंह जी का तहे दिलों स्वागत करता हाँ, जिन्हों की समूलीयत ने साढ़े सारिਆਂ की हौसला अफजाई की है। सर असी आप जी जी आया आखते हुए अपने अपने आप को बड़भागा महसूस कर रहे हैं। सर इस नेक कार्य की प्रेरणा ਅਤੇ मार्गदर्शन आप जी वालों ही दिता गया जदों उद्योगों नाल मीटिंग करते हुए आप जी ने सारे ही उद्योगपतियों को कहा कि मैडिकल इंफ्रास्ट्रक्चर के इंप्रूवमेंट करने लिए अपना योगदान पाया जाए। उस तो बाद सर असी सारे ही इंडस्ट्रीज नाल मीटिंग की, उन्होंने सानू ये कहा कि असी एक कोविड वार्ड इंडस्ट्री वालों लुधियाने के बनावांगे। उस तो बाद सर इस 20 दिन के 20 दिन के अंदर इस वार्ड की स्थापना हुई जिससे कि असी 50 के करीब मरीज इतने दाखिल कर सकते हैं। तो बच्चों लिए भी इतने कुछ बैड राखे रखे गए हैं। सर मैं आज के समारोह के मैडम विनी महाजन जी का भी DGP पंजाब श्री दिनकर गुप्ता जी का भी स्वागत करता हाँ, जिन्होंने सानू हमेशा इस तरीके के कार्यों में प्रेरित किया है। मैं एडिशनल चीफ सैक्रटरी हेल्थ श्री हुशनलाल जी, एडिशनल चीफ सैक्रटरी मेडिकल एजुकेशन श्री DK तिवारी जी और एडिशनल चीफ सैक्रटरी उद्योग श्री आलोक सिंगल जी का भी इस प्रोग्राम के स्वागत करता हाँ। सर मैं डॉक्टर विलियम भट्टी डायरैक्टर CMC हॉस्पिटल और उन्होंने समूची टीम का भी स्वागत करता हाँ, जिन्होंने रिकॉर्ड टाइम के इस वार्ड को बनाने में साड़ी हेल्प की, सानू भरोसा दिलाया कि इस वार्ड के माहिर डॉक्टर ते उन्होंने टीम तैनात करेंगे। मैं पुलिस पब्लिक फाउंडेशन के सारे ही समूह मैंबर्स जोड़े पुलिस के नाल जुड़ के अपना योगदान चंगे कामों के पाते रहते हैं। सर इनका सारे का धन्यवाद करता सर, उन्होंने जी आया भी आता हाँ सर। इस तो अलावा सर श्री राहुल पूजा जी जिन्होंने 2 ऑक्सीजन जनरेशन PSA प्लांट हॉस्पिटल्स के डोनेशन करवाए हैं, उन्होंने का स्वागत करता हाँ। सर असी तुहानू यकीन दिलाते हैं कि कोविड महामारी की लड़ाई के असी पूरी तरीके तैयार हाँ। कोई अगे वेव्स आएंगियां उन्होंने भी साडी पूरी तैयारी है। सर मैं सारे का भी स्वागत करता हाँ जो ऑनलाइन आज इस प्रोग्राम के साडे नाल जुड़े हुए हैं। मैं आस करता हाँ कि आज का समारोह सानू इस तरीके के कार्य करने बहुत ही उत्साहित करेगा। अखीर के मैं उन्होंने सारे सज्जना का तहे दिलों शुक्रगुजार हाँ जिन्होंने इस कार्य को नेड़े चलाने सानू दिलों मदद की। जय हिंद।
हूँ मैं बेनती करता हाँ राहुल पूजा जी को जो कि पास्ट चेयरपर्सन CI पंजाब में है कि रिगार्डिंग इंस्टॉलेशन ऑफ न्यू PSA ऑक्सीजन प्लांट इन CMC and Krishna Charitable with the help of representatives.
Honorable CM sir, so whenever I interacted with you, whether at CIA platform or expert panel under chairmanship of Mr. Morne Balwalia, I was always mesmerized by your committed approach towards social welfare. Sir, it is duty of us, the industry, the citizens, to complement the efforts of the government. The second wave of COVID was a disastrous shock. We all saw so many people leaving us. This has high time that we prepare ourselves for the much apprehended third wave. With the objective of let no one die because of oxygen, we, the members of industry, have contributed to donate for oxygen plants at Christian Medical College and Hospital, Ludhiana, and Krishna Charitable Hospital, Ludhiana. So these plants will be commissioned in 6 to 8 weeks. I am grateful to Ludhiana administration, CSAR, CPSAR, DCPSAR, for helping in negotiations and identifying the right supplier. The support we have always received from Vidiman, DCPSAR, Diwali-ji, Alok-ji, Roshan-ji, and all senior officers has been overwhelming. So I would request you to bless our donors for their noble gesture. Thank you Industries, Happy Projects, Ludhiana Beverages, Newcorn, Uniparts, Happy Products, Health Solutions, our own Rajneesh Industries Private Limited, and around 20 more. So together we all were able to gather around 1.2 crores for these oxygen plants. And these plants will be dedicated to the service of the community.
Thank you. Thank you.
Now I would request Director CMC Dr. Vijay Bhatti to share a few words, and we are thankful to Dr. Bhatti for his cooperation in building up the award. Thank you.
Respected Captain Amrinder Singh Ji, Honorable Chief Minister of Punjab, Ma'am Shrimati Vinny Mahajan, Chief Secretary of Punjab, Shri Dinsar Gupta Ji, DGP Punjab, ACSL, Shri Husnullah Ji. I welcome you all for today's inaugural function of COVID dedicated ward. Our institution is serving the people of Ludhiana, people of Punjab and nation for the last 127 years. When our institution was started, it was with the help of citizens of Ludhiana. And once again, citizens of Ludhiana, they have come forward to help us at the time of COVID-19 crisis. I am grateful to the efforts of this public foundation. For the last so many years, they have helped us to establish new ward. We are going through the COVID-19 crisis. At this moment, we are grateful to the government for the efforts and support which they have provided to our institution to manage the crisis. Once again, I am grateful to all donors, citizens of Ludhiana, and our Honorable Chief Minister, Captain Amrinder Singh Ji, for their help and efforts. Thank you for this. Thank you.
Now, before I invite ADGP Security, Double Security, Shri Inauguration, I would like to thank our DGP Sir, Dinsar Gupta Ji, जिन्हां दे रहनुमाई हेठ पुलिस पब्लिक फाउंडेशन ने इन्ना वधिया काम करके इन्नी जल्दी वार्ड बनाया तो भी समाजिक समाज के वार्ड। थैंक यू सर, थैंक यू DGP sir. Now I would request Shri R.N. Dhoke ji, ADGP, please say a few words and tell about Police Public Foundation. Thank you, sir.
Honorable CMC of Punjab, Ma'am CS Punjab, DGP Sir Punjab, other colleague officers. Sir, when I was Commissioner Police Ludhiana in 2017, that time I felt that we should have some kind of arrangement with the industry. And during that time, then I founded this Police Public Foundation, and we roped in some active people from the industry. So we made the body of 7 members, and we named it Police Public Foundation. So since then, we have been involving PPF in various activities. We have made a lot of welfare projects in police lines. For example, we have made a stadium, sir, with the help of Hero Cycle, and they have spent nearly 1.2 crores. We have made a big conference room, and Pawa Motors, they have spent nearly 2 crore rupees on that. Likewise, sir, we have made other facilities, various courts, football ground, hockey ground, tennis ground, basketball ground, open gym, cricket pitch, and multi-sports facility, indoor facility. For that, we have got nearly 1.7 crore from World meets. Apart from this, sir, we have had a lot of workshops. We have arranged a lot of camps. And for this, all these members and other officers, they were really helpful,
and they were always there to help us in our activities. Sir, in the last month I have spoken with Mr. D.K. Tiwari, and I asked him what is the requirement of city Ludhiana for COVID control. So he said that we need to have some additional beds and oxygen support. So on May, sir, exactly before 1 month, I had a meeting with members, and within 1 month they could make a newly 50-bedded hospital ward, and they have made the element for PSF oxygen also. So in future, sir, we would like to research on non-cover functions of policing, so that PPF will take care of those non-cover functions, and we need to help police administration in getting up the administration. Thank you so much, sir.
Now I would request Madam Mini Mahajan, Chief Secretary. Now I would request Madam Mini Mahajan, Chief Secretary Punjab, please address.
Good afternoon, all. Under the personal leadership of the Chief Minister, the state of Punjab has been working towards the management and control of COVID ever since we encountered this in March last. And I dare say we have achieved much more than many other states achieved in terms of saving our people from this disease. But of course, this would not have been possible without the support, participation, cooperation of all sections of society and all stakeholders. And today's event gives us an opportunity to thank some of those who played a critical role in the state of Punjab's fight against COVID. First of all, I'd like to thank the healthcare system, both government and the respective private sector institutions like CMC. I see faculty and staff of CMC connected today, and I want to thank each one of you for the wonderful work that you did during this pandemic and otherwise also. And we have always admired your selfless service. The state of Punjab, very early on in the crisis, as you know, supported CMC with providing ventilators. I believe 14 ventilators have been provided to CMC. And I'm aware that you have in turn treated the poor patients referred by the government. So thank you to CMC, and through you and through your staff, faculty, to all those private healthcare facilities that did such wonderful work and are continuing to do so. I also want to use this opportunity to thank industry and civil society. You have risen to the occasion. Without our asking, you came forward and offered your support. And whether it was taking up the manufacturing of PPE kits, when in March last year it appeared that we would never be able to put together the number of kits that would be required by our healthcare workers, and Ludhiana industry rose to the challenge. Since then, you have supported the state in so many ways, whether it is giving cryogenic tankers to the state to bring in oxygen from far-flung areas of the country, to providing ventilators, PSA plants, oxygen concentrators, cylinders, cash, so much. So thank you to all the responsible members of industry represented today, Rahul ji and others, and we owe a deep debt of gratitude to you for the social conscience that you have displayed. And of course we have the administration here. So in some ways it was the duty of the civil administration, but I'd like to place on record the wonderful work that district administrations led by DCs like Varinder have done all over the state. And I would like to acknowledge the wonderful work that the police department has done exemplified by people like Rakesh, but all the police officers of the state, I think, have come forward way beyond the call of duty. Their role was not limited just to enforcing restrictions. They were actively reaching out to see how they could help the people of Punjab, how they could be saved from COVID. And I think we've had the most remarkable example of the cooperation and combined efforts of the civil and the police administration, leading to the excellent outcomes that we are seeing. And we will continue those efforts, and we will continue to hope that the state will not see another wave. We will certainly not let any effort, we will not be found wanting in making any effort, but we do know that there are issues like mutations, and if mutant strains come in and catch us by surprise, then we do need to be prepared, and the efforts that we are recognizing today are part of that effort. We will make sure that we do not let the people of Punjab down. But today is a time to thank you all for the wonderful work you're doing. Thank you to the Chief Minister for the leadership that he's given us all through. And thank you to all participants in today's event for their role that they have played, a stellar role under very difficult circumstances. Thank you.
Honorable Chief Minister साहब बेनती करना है कि वो बटन दबा के कोविड वार्ड का उद्घाटन करें, ते ऑक्सीजन प्लांट का MOU करें।
Welcome to the tour of newly created pediatric COVID ward, as next COVID wave is expected to affect children. This ward has been established with kind and generous contribution by Police Public Foundation at an estimated cost of rupees 60 to 70 lakhs within a short time. This ward of 50 beds will handle level 2 category of patients with infections. Strategically located, this ward is equipped with state-of-art equipment, that is cardiac monitors, cardiac defibrillators, oxygen concentrators, syringe pumps, and new ECG machines. Second wave of COVID has been a disastrous shock and taken life of too many people because of oxygen. Taking the oxygen mission forward, members of CII and Ludhiana industry came forward and contributed approximately rupees 1.25 crores for setting up oxygen plants at CMC and Krishna Charitable Hospital. An MOU has been signed wherein these hospitals will provide subsidized treatment to poor patients. These plants will be set up in 6 and 8 weeks and will cater the oxygen needs of hospitals around the year.
Our Chief Secretary, Mrs. Mini Mahajan, Director General Police, Dr. Gupta ji, Mr. Rahul Ahuja, Dr. William Bhatti, Mr. Doke, Rakesh Agarwal, Deputy Commissioner, and all members present here today from our administration, from industry, from the police, who are taking part in this wonderful gesture, which is we are all happy to be presented. We do not know this disease, and I'm sure Dr. Bhatti is sitting there to confirm what I'm saying. Yet we do not know what happened, how it's come, where it's come from, how long it's going to last, how many spikes are going to take place. We've had 2 spikes. And whether we go on like the Spanish flu from 1918 to 1925, it was there for 7 years. 50 million people in the world were affected. So are we going to go that way, or is modern medicine going to be able to control it? In those days, it was, of course, medicine was primitive, times were different. Now times are different. And I think that hopefully, with the way things are going and research is going on in all over the world, and of course communication is very quick. In those days, to get from India to England via the Cape of Good Hope took you 6 months. Now in a few seconds you are through to your colleagues anywhere in the world, and our own medical team led by Dr. Talwar is every evening sitting down and talking to people all over the country and all over the world who are involved in this battle against COVID. So while that is going on at the national level, we are all making our efforts, and you today have made your contribution towards this battle, and then this cooperation between the police, the administration, CMC and all is something which is a very, I hope other districts and other states also go in for this, so that the entire society as a whole is toward meeting this challenge which is now engulfing the world. So we have today, we are here to inaugurate, to be present at the inauguration of this lovely ward which you just seen pictures of. Absolutely modern ward with all the contributions necessary, because one doesn't know what is going to happen. As you yourself mentioned, you don't know whether the 3rd spike is coming and when it is coming. I hope it never comes, but if we can't live on hope, we have to be prepared for the worst. And this effort, which was started by Mr. Doke, as he mentioned to us in 2017, has now blossomed and is continuing to blossom. And I'm very actually proud of the police of our state, led by Mr. Nekar Gupta, who has always come forward, and the entire force has come forward. Whether it was the 1st spike, they came out feeding everybody where it was necessary, poor people who couldn't eat. I mean, we had one slogan in Punjab, that nobody will go to sleep empty stomach. And that is what the Punjab police took on. That is not their job to take it on, as the Chief Secretary was mentioning. That's an enforcement body. But here was the humanitarian part of it. And they took that on, and here again, this time, again people following that same slogan have set up police lines, telephone lines where they can be called anytime, and if anybody needs food and they haven't got it, the Punjab police goes and delivers it to their home. That is in addition to what the government is doing. We are doing things our way, but of course it's much easier for the government to do rather than for the police to do, because all day they are on to the law and order business, and then sometimes they are called at 11 at night or 12 at night and they have to get up and take food to someone. And so it's a very sort of, for me, a feeling of great satisfaction, and I'm sure it is to every policeman who's part of the Punjab Police under our DGP, Mr. Gupta, that he is contributing towards this fight. And to the doctors, of course, it's your job to do this, and you need support from us, and Punjab is always there to support you. And more than that is our industry, which has always come forward. And I know in Ludhiana industry was always there. Whenever we needed them for anything, you just had to make one telephone call and they would come. I spoke to somebody in Hoshiarpur and they sent 1,000 cylinders. You spoke to Vardhaman, they sent. You spoke to Osalji, they sent. You spoke to Trident, they sent. Everyone contributed and took part in this battle that we are all faced with. Nobody knows when it's going to be over, but today the way the society has come together and the way we are going about it, I'm sure that time will come and then we will get the better of this COVID, this Corona-19 or whatever it's called, COVID-19, and we will sort of emerge victorious as a world, as a global world. And also that our own city, our situation can becoming much better in the country. I hope it is we're going to see an end of it, take our own state. I mean, I remember when I was concerned, when I would get these daily reports, and I had one but for 9,500 new cases, and today is 2,184. So things are going down. Even in casualties, in deaths, for instance, we had gone up to nearly 280 and we are today at 94. And sadly, overall, we have 14,649 people who have succumbed to this disease. I hope that this is something of the past now, but it's going to be history and it's not going to happen anymore. But as I said, nobody knows anything about this disease, so we have to be prepared. And your contribution is going to be there, and if ever a crisis does emerge. And I see this wonderful word that you put up, and that effort and that sort of comradeship developed between the police and the civil and the medical world, and that is what it got. So it's a pleasure to me to be part of this function today in which you've inaugurating this ward, and I hope whenever the time comes, if it comes, which I hope it doesn't come, but as I said, you'll never know this disease, so if it does come, that this battle we will carry on till we will finally overcome this and bring our country and our globe back to normal. Thank you all very much, and my good wishes to all of you, and my thanks to all of you who have participated in making this contribution towards this COVID business. Thank you.
Thank you, sir. Thank you,
Thank you, sir. Thank you.
Before I invite PC Mr. Vrinder Sharma ji, I will be failing my duties if I don't thank few people who are doing a great work towards the society. Mr. Bhavdeep, President CI, Mr. Amit Thapar, Vice Chairman CI Punjab, Ashpreet ji, Chairperson Ludhiana, Kar Urja ji, President CICU. They are all doing, we all run different stations, but they are doing great jobs towards the society. So we are very much thankful to them, we work together. And now would I request Shri Vrinder Sharma ji, Deputy Commissioner Ludhiana, to please propose a vote of thanks.
सर मैं आप सारे आज के इस फंक्शन ਲਈ ਜਿਹੜਾ ਤੁਸੀਂ ਕੀਮਤੀ ਸਮਾਂ ਕੱਢਿਆ ਬਹੁਤ ਬਹੁਤ ਧੰਨਵਾਦ ਕਰਦਾ ਹਾਂ ਸਰ ਅੰਡਰ ਯੋਰ ਲੀਡਰਸ਼ਿਪ ਆਈ ਵਿਲ ਬੀ ਫੀਲਿੰਗ ਇਨ ਮਾਈ ਡਿਊਟੀ ਅਗਰ ਮੈਂ ਤੁਹਾਡਾ ਧੰਨਵਾਦ ਨਾ ਕਰਾਂ ਜਿਸ ਤਰ੍ਹਾਂ ਦੀ ਕਲੀਅਰ ਕੱਟ ਲੀਡਰਸ਼ਿਪ ਮਿਲੀ ਹੈ ਔਰ ਇਹ ਆਈ ਵੁੱਡ ਲਾਈਕ ਟੂ ਅੰਡਰਲਾਈਨ ਕਿ ਕਿਸੇ ਵੀ ਐਡਮਿਨਿਸਟ੍ਰੇਟਰ ਦਾ ਜਿਹੜਾ ਸਭ ਤੋਂ ਮੈਂ ਸੋਚਦਾ ਸੀ ਕਿ ਕੋਈ ਲਾਈਟ ਕਲੀਅਰ ਹੋ ਸਕਦਾ ਹੈ ਜਿਸ ਤਰ੍ਹਾਂ ਦੀ ਕਿ ਅਸੀਂ ਦੇਸ਼ ਦੀ ਰਾਜਧਾਨੀ ਜਾਂ ਹੋਰ ਵੱਡੇ ਸ਼ਹਿਰਾਂ 'ਚ ਦੇਖੀਏ ਮੈਨੂੰ ਇਹ ਸੀਗਾ ਕਿ ਸਾਡਾ ਸੰਗਠਿਤ ਸ਼ਹਿਰ ਹੋਣ ਕਰਕੇ ਕਦੇ ਇਸ ਤਰ੍ਹਾਂ ਦਾ ਸੀਨ ਇੱਥੇ ਨਾ ਆ ਜਾਵੇ ਬਟ ਤੁਹਾਡਾ ਵਿਜ਼ਨ ਔਰ ਮੈਮ ਔਰ ਡੀਜੀਪੀ ਸਰ ਉਹਨਾਂ ਨੇ ਜਿਸ ਤਰ੍ਹਾਂ ਦਿਨ ਰਾਤ ਸਰ ਸਾਨੂੰ ਲਗਾਤਾਰ ਆਕਸੀਜਨ ਦੀ ਸਪਲਾਈ ਫਾਰਜ਼ਨਮ ਏਰੀਆ ਲਾਈਕ ਝਾਰਖੰਡ ਤੇ ਛੱਤੀਸਗੜ੍ਹ ਵਗੈਰਾ ਤੋਂ ਮਿਲੀ ਹੈ ਉਸ ਕਰਕੇ ਸਾਡੇ ਸ਼ਹਿਰ ਦੇ ਵਿੱਚ ਇੱਕ ਵੀ ਜਿਹੜੀ ਜਾਨ ਹੈਗੀ ਹੈ ਆਕਸੀਜਨ ਦੀ ਕਮੀ ਕਰਕੇ ਨਹੀਂ ਗਈ ਔਰ ਸਰ ਮੈਂ ਇਹਦੇ ਲਈ ਤੁਹਾਡਾ ਬਹੁਤ ਬਹੁਤ ਧੰਨਵਾਦ ਕਰਦਾ ਹਾਂ ਡੀਜੀਪੀ ਸਾਹਿਬ ਦਾ ਵੀ ਅਸੀਂ ਇਸ ਟਾਈਮ ਇਹਦੇ ਨਾਲੋਂ ਨਾਲ ਸਰ ਮੈਂ ਸੰਘੀ ਅਦਾਰਿਆਂ ਦੇ ਸਾਰੇ ਨੁਮਾਇੰਦੇ ਜਿਹੜੇ ਇਹਨਾਂ ਦਾ ਧੰਨਵਾਦ ਇਸ ਗੱਲ ਲਈ ਕਰਦਾ ਕਿ ਜਦੋਂ ਕੋਈ ਵੈਕਸੀਨ ਲਗਾਉਣ ਲਈ ਤਿਆਰ ਨਹੀਂ ਸੀ ਲੇਕਿਨ ਫਾਰਵਰਡ ਇਹਨਾਂ ਨੇ ਵੱਡੇ ਪੱਧਰ ਤੇ ਆਪਣੇ ਅਦਾਰਿਆਂ ਦੇ ਵਿੱਚ ਵੈਕਸੀਨੇਸ਼ਨ ਕਰਾਈ ਉਹਦੇ ਕਰਕੇ ਵੀ ਅਸੀਂ ਇਹਦੀ ਜਿਹੜੀ ਧਾਰ ਹੈਗੀ ਉਹਨੂੰ ਮੱਠਾ ਕਰਨ 'ਚ ਕਾਮਯਾਬ ਹੋ ਗਏ ਔਰ ਸਰ ਆਈ ਐਮ ਸ਼ੋਰ ਕਿ ਸਰ ਦੀ ਲੀਡਰਸ਼ਿਪ ਦੇ ਅੰਡਰ ਅਸੀਂ ਜਿਹੜੀ ਤੀਜੀ ਵੇਵ ਹੈਗੀ ਹੈ ਕੋਸ਼ਿਸ਼ ਕਰਾਂਗੇ ਨਾ ਆਵੇ ਔਰ ਅਗਰ ਆਵੇ ਵੀ ਤਾਂ ਉਸ 'ਚ ਘੱਟ ਤੋਂ ਘੱਟ ਨੁਕਸਾਨ ਹੋਵੇ ਸਰ ਥੈਂਕ ਯੂ ਵੈਰੀ ਮਚ ਸਾਡੇ ਲਈ ਇੰਨਾ ਜ਼ਿਆਦਾ
Thank you, Vrinder. Thank you.
Thank you, sir.
Thank you, sir. Thank you, sir.
Thank you, sir.
Thank you all of you. Thank you all.
Thank you, sir. Thank you, sir.
Yeah.
मैं हूँ सारिया का बहुत थैंक्स कर रहा आई कैन सी द गैलेक्सी ऑफ इंडस्ट्रीज सारे थे सारे ऑफिसर्स भी थे ऑफिसर भी
मौजूद ने ये सारा कुछ थोड़े सहयोग वगैरह हो सकता क्योंकि अगे भी मैं सी साहब हमेशा ये कहते हैं कि जी सोसाइटी है वो साइलों के बीच नहीं काम करती और सेम भी जी एडमिनिस्ट्रेशन है या पुलिस की एडमिनिस्ट्रेशन है लॉ एंड ऑर्डर है जब तक लोगों का सहयोग ना हो कामयाबी नहीं होगी जिस तरह की कामनेस और सहयोग देना बड़ा शहर उनसे बाहर दिखाई है और जिस तरह की कंट्रीब्यूशन बोथ इन टर्म्स ऑफ मॉरल सपोर्ट और फाइनेंशियल सपोर्ट कितनी है बहुत ही डूंगी प्रशंसा के हकदार हूँ और मैं एक तो शलाघा कर रहा हूँ ਜਦੋਂ कोई वैक्सीन लगाने की तैयार नहीं थी उन्होंने याद है सीसू होए CII होए यूनाइटेड सेक्टर पार्ट्स एसोसिएशन होए या बड़े अदारे जिन्होंने जो और बहुत सारे अदारे ने खुद इन्हों का जोड़ा है अपना पूजा साहब का जो यूनिट है उत्थे भी असं जाके आए तुम सारिया इन्ना भरना भर दिता और उस करके एजेंसी ऑफिस के बीच बच्चे डॉक्टर पट्टी भी भी आए हैं इन्होंने रात रात भी कोई जगा के लोगों की एडमिशन कराते रहे संदीप और मेरे कलीग रगिया वगैरह है नहीं इन्होंने दिन रात सारे काम किया और सिविल सर्जन इन्होंने जितनी भी टीम लगी है सारे बहुत अच्छा काम किया स्पीकर साहब और CP सर का ये विजन सीगा कि ये जो यूनिट स्थापित किया जाए बट उससे भी चार इस गल में लग गई कि 2 ऑक्सीजन प्लांट्स भी पूजा साहब और इन्होंने एफर्ट करके सारे जितने कंट्रीब्यूटर्स ने जिन्हें कि नाम पढ़े गए 4-5 नाम तो बाद में दसिया गया कि 20 लोग और भी ने और उसी अजित के समा कटिया पता है कि इंडस्ट्रियलिस्ट ने सब तो कीमती चीज जो समा होता है उसी एक कदम साढ़े सिर मसले और मैं इस उसकी आस अगे फ्यूचर की भी करता रहूँगा बहुत बहुत धन्यवाद
फोटो